So now I'd like to give you some specific information on your upcoming rhinoplasty. So you'll have the surgery, then you're going to spend some time in the recovery room, and then you'll go home. You're going to go home with a splint on, some tape on, some internal packing that will all help to shape and keep that rhinoplasty result, your nose basically, where I put it. So you want to be very cautious with that. You'll also have what we call a mustache dressing, which is some gauze folded underneath your nose and taped over here on your cheeks. That's the only part you can touch and change. It just collects a little drainage basically, so a little blood and that kind of thing. So as often as you need to, take that off, change it. After a day or a few days, you shouldn't need that anymore, but everything else stays on. You want to make sure and be careful with everything. So your restrictions would be no getting your blood pressure up, no sleeping on the side of your face. You want to stay just on the back of your head, stay elevated, no pressure of any type, no wearing glasses or sunglasses on your nose, nothing like that. No nose blowing, nothing in that range. You'll have some medications, some pain medicine, some nausea medicine. You can take those both as you need it. And you'll have some antibiotics that you'll take for 5 days. That's because of the packing that's in there. Also, you're going to just hate me for the packing. That stuff annoys you a lot. Your throat's going to get sore because you're having to be a mouth breather through those first 5 or 6 days. So get some cough drops, get some throat spray, something like that. That'll help you through the process. Then you're going to see me at around day 5, 6, or at the latest day 7. And at that point, we'll take everything off, everything from the inside out, and we'll take these little sutures that are in the columella portion of the nose, we'll take those out as well. I'll look at you, and then I'm going to replace just the outer part, so the tape and the splint. That will stay on for roughly 5 or so more days. You'll then ultimately see me again at the 10 to 12 day mark, and we'll take all that off for good. So you'll be done with that, not have to worry about it again, so that should work quite nicely. Most people don't have a lot of pain with this, but if you bump it, you definitely will know. So be very careful with that because it'll hurt and it could hurt our results. So we want to be really cautious with that. You can sleep upright for several weeks. That can be helpful, but at least the first couple weeks, try to do that. And don't do anything that could apply pressure to your nose. Don't do any activities that could potentially put you at risk of hitting your nose. So even something like yoga is not specifically going to hurt your nose, but if you kind of trip a little bit or fall down, anything could hurt it. So you want to be very cautious with that through that time as well. But overall, this should go quite well for you. And it's really a pretty well tolerated surgery other than that first 5 or so days where you can't breathe through your nose, then you should do okay. Obviously, if you have any questions or issues, call us beforehand, but I look forward to seeing you for surgery.